Welcome to the Eye Experts. I'm Dr. Eli Sluch, and today we're going to be talking about health insurance. Health insurance is a very confusing topic, at least for me. Since practicing medicine for a few years, I have gotten a better understanding of it from the consumer side and from the provider side. So now I'd like to share some of that knowledge with you. Medical bills is the #1 cause of bankruptcy in America. Therefore, if you are able to afford health insurance, I highly recommend you get it. The question is, which one should you get? For commercial insurance, there's high deductible plans, low deductible plans, and HSA plans. The difference between them is how much you pay for the insurance and how much does it cover. Let's go over some of the terms that the insurance uses. What is a deductible? A deductible is the amount of money you have to pay before your insurance kicks in. It seems very unfair because you are paying for the health insurance throughout the year, but that's how most plans work. Therefore, if you have a deductible on your insurance plan, that is the amount of money you owe before most of the insurance will kick in. Out-of-pocket maximum is like a second deductible. Once you meet your deductible, your insurance does start paying for some of your medical bills, but usually does not cover you 100%. Once you meet your out-of-pocket maximum of the amount of money you owe, then your insurance starts covering you 100%. So far seems pretty unfair, right? Well, the insurance does cap you at the out-of-pocket maximum, so you shouldn't be responsible for hundreds of thousands of dollars. And number 2, the insurance gives you access to in-network providers. Now, what are those? Have you ever seen your hospital bill where the hospital bills you for tens of thousands of dollars and then the insurance reduces it to like $1,000? That's because it's an in-network provider. Due to price fixing laws, doctors and hospitals are not allowed to charge the same rate for the services, so they all make up a number. If you go to see an in-network provider, that provider has a negotiated price with the insurance company. Therefore, that number is much more reasonable than what you would normally get. If you go to an out-of-network provider, they can charge you any number they want. When you go see the doctor's office at the hospital and you sign the consent to treat, it also gives them the consent to bill. So it's always important to be cognizant of that fact and try to go to in-network providers when you can. Medicare Part A is responsible for hospital visits. Medicare Part B is responsible for doctor visits. Medicare Part D covers your prescriptions. For Medicare Part B, you can get regular Medicare Part B, you can buy a supplemental plan, or you can get a Medicare Advantage plan. If you buy a supplement plan, that keeps you in Medicare Part B, which most doctors take, and adds other benefits like reducing your deductible and also sometimes adds vision or dental. If you get an Advantage plan, that replaces your Medicare Part B. Therefore, you may find out that your doctor that you normally saw for a long time no longer takes that insurance. So be very cognizant when you switch from a regular Medicare Part B or a Medicare Part B supplemental plan to a Medicare Advantage plan, because you may find out that you're suddenly no longer in network. What is vision insurance? Vision insurance is special insurance used to cover things like glasses, contact lenses, and a visit to your optometrist to obtain those. If you have an eye problem, you can actually use your medical insurance to see an ophthalmologist or an optometrist who takes medical insurance. Those are medical conditions, therefore if you have regular health insurance, most likely you're able to go see an eye provider to get it treated.